Hi, everyone, and thank you for joining. My name is Alicia, and today I will be discussing burnout and compassion fatigue, as well as their impact on counselors and the quality of care that we provide to others. Here's an overview of what you can expect from this presentation today. Firstly, I will start by explaining what is burnout and what is compassion fatigue, and how do they differ. Secondly, I'll be outlining the symptoms, risk indicators, and contributing factors to both, followed by prevention and mitigation strategies. Then I'll dive into implications for practice as well as ethical and considerable considerations. Finally, I'll be ending with a quick summary and we'll leave on some thought-provoking questions for our discussion. So, what is burnout? Burnout is a pervasive and debilitating state of emotional, physical, and cognitive exhaustion that develops when stress becomes chronic and unmanaged. While it isn't a formal medical diagnosis, burnout is recognized as an occupational phenomenon resulting from chronic workplace stress that hasn't been successfully managed. And while it has many symptoms, burnout is characterized by three key elements. The first one being exhaustion, where individuals feel completely drained physically, mentally, and emotionally. The second one is cynicism or mental distance from work, often seen as detachment or a loss of motivation. And finally, the last one, reduced professional efficacy. While burnout can occur in any profession, it's especially common in high stress, people oriented fields like healthcare, education, and social services. Interestingly, research shows that it's often those who push themselves the hardest that often have the least left to give. So I like to think of burnout as it's like a match that's been burning for too long. At first, that flame represented passion and dedication to the work, but without proper rest and recovery, it eventually consumes the match completely, and what once gave light and energy turns into ash. Recognizing burnout early and prioritizing recovery and prevention are essential because while it's not a medical diagnosis, the impacts on health, relationships, and performance are very real. Burnout can affect people in multiple ways, but here are the most common signs of burnout. So, emotionally, it can lead to anger and irritability, cynicism. It can create feelings of helplessness and hopelessness, loss of motivation, or sense of purpose. It can also result in a reduced sense of satisfaction and accomplishment. Cognitively, attention, memory, and decision making suffer. Physically, it leads to chronic fatigue, headaches, muscle tension, sleep disturbances, digestive issues, and even increases the risk of chronic illness because it weakens the immune system. And finally, we have behaviorally. Individuals may withdraw or isolate. They might have increased conflicts within their relationships with others, and they may have decreased motivation, subsequently leading to lower productivity and work performance. They may also engage in increased substance use, neglect responsibilities, and their own self care. Now, on the other hand, what is compassion fatigue? Compassion fatigue is often described as the cost of caring. It's what happens when you pour your emotional energy into helping others who are suffering over and over again without enough time or space to recharge. It's very common in helping professions such as therapy, nursing, or veterinary care, where compassion is literally a part of the job description. Over time, that exposure to others' pain can lead to empathetic distress and secondary trauma, a kind of emotional residue that builds up gradually and affects how we feel, think, and connect with others. Research suggests that when we take on others' pain as our own, the brain's stress systems get overactivated and we become emotionally and physically exhausted, and we lose that sense of balance and fulfillment that compassion normally brings. Compassion fatigue can build gradually or appear suddenly after traumatic exposure. Similarly to burnout, compassion fatigue affects people in many different ways, but here are the most common symptoms. So, first we have emotionally, it can lead to anger and irritability, guilt, emotional detachment, sadness, anxiety, reduced empathy, as well as feelings of helplessness or hopelessness. Cognitively, intrusive thoughts are common. Individuals may have difficulty separating others' pain from their own or worry excessively about clients. And they also might have an impaired ability to think clearly. Physically, the signs are quite similar to burnout, so it can lead to chronic fatigue, headaches, muscle tension, sleep disturbances, and nightmares, heightened physiological arousal, digestive issues, and also a weakened immune system. Finally, behaviorally and relationally, individuals may experience emotional withdrawal and isolation. They may dread going to work or working with certain specific clients. They might experience decreased motivation, subsequently leading to lower productivity and work performance. Individuals might also engage in more numbing behaviors such as increased substance use and binge eating, and they might neglect self care as well. These shifts, whether they're emotional, physical, cognitive, relational, are all signs that the cost of caring has started to take a toll on you. What causes and contributes to burnout? Burnout is rarely caused by one single factor. It's typically the result of interacting individual, workplace, and environmental pressures. At the individual level, traits like perfectionism, high expectations, and type A tendencies increase vulnerability. People with a strong external locus of control, meaning those who feel that events are determined by forces outside of their control, tend to feel more powerless and therefore more prone to burnout. Personality also plays a role. Research shows that high neuroticism predicts burnout risk, whereas extroversion, agreeableness, and conscientiousness serve as protective factors. Coping styles are another major contributor. Emotion focused or avoidant coping, like denial or venting, tend to increase burnout, while active problem focused strategies reduce it. Additionally, low self esteem and poor sleep quality also increases vulnerability. In fact, a 2023 study found that sleep problems multiplied burnout risk by nearly 4 times. In terms of workplace factors, excessive workloads, long hours, and night shifts can disrupt rest and emotional balance. Lack of autonomy, recognition, or managerial support also serve as factors. Poor work-life balance, moral distress, and ethical conflicts, as well as unhealthy coworker dynamics, further decrease resilience. Finally, environmental and demographic factors also play a part. So younger or less experienced workers, especially those without a strong social support system, report higher burnout rates. Urban work environments and high pressure settings, as well as financial stress and low pay, can further fuel the cycle. In short, burnout thrives where demands exceed resources and where self care and systemic support are lacking. What causes and contributes to compassion fatigue? Compassion fatigue is also complex and develops through an interaction of many stressors, whether they're personal, professional, or environmental. On an individual level, those of us who are highly empathetic or emotionally invested are often the most at risk. It's not that caring too much is the problem, it's that we often neglect our own recovery. When we carry unresolved stress, struggle with poor sleep, physical health, having difficulty setting boundaries, and having ineffective coping strategies, or experiencing moral distress, our resilience begins to decrease. At the workplace level, factors like excessive workload, long shifts, night shifts, understaffing, a poor work-life balance, and a constant exposure to clients' trauma all play a significant role. Add in a lack of recognition in a workplace conflict, and a sense of efficacy and satisfaction drops. Finally, there are environmental pressures like financial stress, limited peer support, and access to supervision or counseling. These are all some of the causes of compassion fatigue. Additionally, the lack of time to process our own grief after a client crisis can absolutely accumulate over time and wear us down. Now, you might be wondering, what's the difference between the two? Although burnout and compassion fatigue definitely overlap, they are distinct in both their causes and their emotional impact. So, burnout stems from, as I mentioned, chronic workplace stress, heavy workloads, or systemic pressures, and builds gradually over time. It's often tied to long hours, limited control, and lack of organizational support. Professionals experiencing burnout symptoms often improve with rest or time away from the job. On the other hand, compassion fatigue arises from continuous exposure to others' trauma and suffering, essentially an empathy overload. Um, as I mentioned, it can come on suddenly after hearing or witnessing traumatic stories, or can build gradually over time as well. It involves secondary traumatic stress. Unlike burnout, compassion fatigue often mirrors symptoms of PTSD, such as intrusive thoughts, sleep disturbances, or psychological arousal. Over time, caregivers may find themselves emotionally numb or unable to connect, struggling to maintain compassion for others and themselves as well. In summary, while burnout is primarily work related, compassion fatigue is emotionally trauma related. Recognizing the difference is really crucial because it guides us on how to respond. So, burnout may call for workload changes and boundaries, while compassion fatigue might require emotional processing, supervision, and trauma informed self care. Burnout does not resolve through willpower alone. It requires both individual and organizational change. Mindfulness and meditation can help you notice early signs of stress before they escalate. Research also shows that spiritual or religious practice can serve as additional sources of resilience. On a more personal level, burnout prevention starts with self-care and restoring your basic physiological needs. So, including quality sleep, nutrition, exercise, and hydration helps stabilize mood and energy levels, while social support and engaging in activities that bring you joy, like certain hobbies or time with your loved ones, can help rebuild emotional balance. At the workplace level, burnout prevention can start with setting boundaries, avoiding checking emails after work if possible, taking lunch breaks, and using that vacation time. These are necessary recovery periods for sustained functioning. Workplaces that provide manageable workloads and supportive supervision see significantly lower burnout rates, reduced isolation, and foster community resilience. In terms of evidence-based interventions, cognitive behavioral therapy can help mitigate burnout through challenging distorted thinking and maladaptive coping behaviors, as well as increasing self-efficacy. Acceptance and commitment therapy can enhance resilience and psychological flexibility. Mindfulness-based interventions can enhance emotional regulation and reduce rumination, as well as build resilience. And finally, job demands resources model can increase social support, autonomy, and professional development. Similarly to burnout, compassion fatigue doesn't just resolve on its own, it requires intentional care and ongoing awareness. The first step is mindfulness. As mentioned, mindfulness and meditation can help you notice early signs of stress before they escalate. Being aware of your internal state, such as tensions in your body, emotional exhaustion, or irritability, as well as noticing reactions and triggers, can help prevent deeper compassion fatigue. Self-care practices are the foundation of resilience. This includes maintaining healthy eating habits, prioritizing sleep, staying hydrated, and incorporating physical activity as nourishment for your body and mind. Social support and engaging in meaningful activities outside of work are equally vital, reminding you of your identity beyond your professional role. Next, it's essential that we set and maintain boundaries. In helping professions, it's there's a very strong drive to want to do it all and fix it all, but when everyone else occupies space, your space for your emotions, there's nothing left for yourself. Saying no, taking breaks, advocating for manageable workloads are also essential, and meeting with a therapist or a supervisor can also help process the emotional weight of the work. Lastly, from a clinical standpoint, compassion-focused therapy can help in restoring and balancing self-compassion, addressing guilt and shame for not doing enough, and acceptance and commitment therapy can enhance resilience and psychological flexibility. Cognitive behavioral therapy can challenge distorted thinking and maladaptive coping behaviors, and mindfulness-based intervention can enhance emotional regulation, grounding, and awareness around compassion fatigue. When assessing for burnout and compassion fatigue, it begins with choosing the right tool for your context. So for burnout, the MACE-LAC Burnout Inventory, or MBI, assessment is the golden standard. It assesses three core dimensions: emotional exhaustion, cynicism, and reduced professional efficacy, so the three key elements that we discussed earlier. This makes it well suited for when your focus is on occupational stress in settings like healthcare, education, human services, etc. For compassion fatigue, particularly within helping professions where exposure to trauma or caregiving stress is key, the professional quality of life scale is particularly useful. It not only measures the negative side, so for example, a secondary traumatic stress, but also compassion satisfaction, which essentially tells you what aspects of work are still meaningful and protective to you. When selecting an assessment, it's important to consider a few things. One being, what populations are you working with? For example, therapists, nurses, educators. The second one is, what is the main risk you are assessing? So is it workload? Is it trauma exposure? Is it emotional distance, for example? Lastly, is the instrument validated for that group or culture? We always want to ensure that the assessments we use are culturally sensitive. Once you have the results, the data can then guide your intervention choices. For example, if your MBI shows high cynicism, you might want to focus on job meaning and connection. On the other hand, if your professional quality of life scale shows high secondary traumatic stress, you might want to add trauma-informed supervision and peer debriefing. Essentially, valid assessments equal accurate identification of symptoms, which guide targeted interventions and lead to better outcomes for practitioners as well as their clients. Now let's look at how burnout and compassion fatigue translate into practice. So in counseling, education, and healthcare, these aren't just individual struggle, and they really do have bigger systemic effects. In fact, research shows that they contribute to reduced patient safety, diminished quality of care, and even workplace injuries. For counselors, they can manifest as emotional detachment, irritability, or loss of empathy, which all of these directly impact therapeutic relationship. Practically, this means prevention and monitoring need to be embedded at multiple levels. On the individual level, interventions like mindfulness, self-compassion, acceptance, and commitment therapy-based stress management, all of these things can help build psychological flexibility and resilience. At the supervisory and educational levels, incorporating structured debriefing, reflective practice, and training on boundary setting and trauma-informed care is essential. At the organizational level, we need to ensure reasonable workloads, recovery time, supportive leadership, and promote a culture that normalizes help seeking and prioritizes well-being. We can also use assessments like the MBI or the Professional Quality of Life Scale to allow for early detection and intervention. Essentially, supporting healthcare workers' well-being isn't optional, it's integral to effective and ethical care. From an ethical standpoint, managing burnout and compassion fatigue isn't just good practice, but it's actually a professional obligation. Both the Canadian Psychological Association and the Canadian Counseling and Psychotherapy Association codes of ethics emphasize the duty to maintain personal well-being and to minimize harm to clients as part of competence. When we're emotionally exhausted or detached, it can impair judgment, empathy, and even harm clients. Supervision and consultation act as ethical safeguards. They allow practitioners to process emotional strain before it affects their work, and maintaining clear professional boundaries also helps protect both the counselor and the client. At a systemic level, workplaces share this ethical responsibility too. Supporting staff wellness through supervision, flexible workloads, and open dialogue is essential. Ultimately, as we've mentioned many times before, ethical care begins with really caring for ourselves because when we are well, our clients receive better care as well. When we think about cultural considerations, culture plays a really powerful role in how burnout and compassion fatigue are experienced. It not only influences how we respond to stress, but also what's considered normal and acceptable when it comes to caring for ourselves and others. For example, in collectivist cultures where harmony, duty, and interdependence are central, helping professionals may feel a strong pressure to prioritize others and suppress their own emotions. This can lead to emotional exhaustion, depersonalization, and guilt about setting boundaries and limits. In contrast, individualistic cultures, such as those in many Western societies, tend to encourage personal boundaries and self care, which may provide some protection against burnout and compassion fatigue. However, the stigma around mental health is still a barrier in many, many cultural contexts, with professionals viewing seeking help as a weakness, leading to unaddressed fatigue and emotional fatigue. Cultural intelligence and inclusive organizational practices such as culturally sensitive supervision and acknowledgement of diverse coping styles have been shown to reduce burnout risk. Many practitioners from marginalized cultures may face added burdens, including racial, ethnic stress, invisibility, added emotional labor, etc. Lastly, as previously mentioned, spirituality, religion, and a sense of community can serve as protective factors, offering meaning, connection, and resilience. Ultimately, culture isn't just a background variable, it's central to understanding, preventing, and addressing issues like burnout and compassion fatigue. As I approach the end of my presentation, this slide summarizes some of the key points of the presentation on burnout and compassion fatigue. So, burnout is a type of work-related stress, develops gradually and is often linked with heavy workloads, long hours, and organizational pressures. Can leave you feeling emotionally exhausted, less effective, and disconnected from your work. In contrast, compassion fatigue is a form of trauma-related stress that arises from working closely with clients who have experienced trauma. This can appear sometimes more suddenly and is associated with both emotional and physical strain, sometimes referred to as secondary traumatic stress. While burnout and compassion fatigue have different causes, they share some important consequences. Both can negatively affect client safety, satisfaction, and overall quality of care. This is why certain strategies are essential for the prevention and mitigation of both of these. Self-care and setting professional boundaries help counselors maintain resilience, manage stress, and continue providing effective care. Additionally, ethical and cultural awareness ensures that counselors uphold professional standards while being sensitive to the diverse backgrounds and needs of their clients. By understanding these differences and implementing protective strategies, counselors can safeguard their own well-being and maintain high-quality, ethical care for the clients that they serve. I want to thank everyone for listening to my presentation, and I'm going to leave you with a few thought-provoking questions to get you thinking, one about yourself and also to help relate to some of your peers and create some good discussions in our discussion group. So the first one is what personality traits of yours, for example, type A tendencies, perfectionism, maybe you're an empath, things that things of that nature that might make you more susceptible to burnout or compassion fatigue, and how can you use the self-awareness to create proactive personal self-care strategies. Second question is, due to its extensive use, the burnout label is very common now, and it might actually mask some depressive conditions, increasing the risk of depression going underdiagnosed and untreated. So, how can you discern between burnout, compassion fatigue, and underlying mental health conditions in yourself and in your colleagues and your patients? Third question, how do burnout and compassion fatigue relate to your presentation topic? Fourth question, can personal experience with trauma make you more vulnerable to burnout and compassion fatigue or more resilient? Tell me what you think. Number five, what unrealistic expectations or standards do you hold for yourself, such as perfectionism, always needing to fix everyone's problems, and things like that, that might contribute to burnout or compassion fatigue? And how can you adjust these standards to support your well being?